Okay, good morning, everyone. Thank you for participating in this NISAC webinar, exploring county ingenuity and responding to and educating our youngest population in special needs pre-K services during the COVID-19 pandemic. We are joined today by state and county experts in program delivery to discuss how counties are adapting to a remote learning environment and what the future holds for congregate-based services. My name is Ryan Gregoire. I am the Legislative Director for your association. We are joined today by Connie Donahue, the Director of the Bureau of Early Intervention at the New York State Department of Health, Suzanne Bowling, the lead at the New York State Education Department for Special Education Policy, and Carrie White, the Director of Children and Youth with Special Healthcare Needs for Saratoga County. The Early Intervention Program is administered by the New York State Department of Health, while preschool special education primarily falls under the jurisdiction of the State Education Department. We are pleased to be joined by representatives from both state agencies, as well as Carrie at the county level to provide this perspective from our implementation point of view. NISAC has been working closely over the past several months in partnership with NISHO, the organization representing county health departments. And we are extremely grateful, and I can speak from my own point of view, and I know our Executive Director, Stephen Aquario, shares my sentiment for both Connie and Suzanne for their partnership. The two of them have been really incredible allies in providing information and really updating counties on what's going on in both of these programs, and they've been tremendous partners of ours. So again, I can't thank both of them enough for joining us. Following the presentations this morning, we're going to open the webinar up to questions from participants. Please note that this session is being recorded, and it will be posted with a copy of the slide deck on the NISAC website later today at www.nisac.org/webinars. If you have a question during the presentation, please type it into the question panel on the right hand of your screen. We will answer those questions in the order they are received after today's planned remarks. Again, thank you for being with us today. We have a tremendous number of counties joining us, and I'm grateful for everyone taking some time out of their morning to join us on this NISAC webinar. We hope that you find this presentation helpful and educational. And with that, I am now going to turn the presentation over to Connie Donahue.
Thank you so much, Ryan, and thanks to everyone for joining today. I'm looking forward to doing this. If some of the counties were present at our virtual all-county meeting last week, some of this information will be familiar, but today we have the extra bonus of being joined by State Education Department, Suzanne Bowling, and also Carrie White from Saratoga County. So you can go to the next slide. Obviously, we're going to talk about early intervention programs, services, and transition. And one more, please. Thank you. So here's our sort of agenda for the early intervention slice of this presentation. We're going to talk about the background of the early intervention program very quickly. As everyone knows, we're Part C of the Individuals with Disabilities Education Act. Talk a little bit about the early intervention program guidance that was issued during the COVID-19 declared state of emergency, public health law that guides transition, and then some requirements on transition, and finally move on to preschool special education programs and services under Part B of IDEA. So just a couple background slides and you can move forward. Thanks. So as we said, New York's early intervention program for infants and toddlers with developmental disabilities and their families, and it is our state's implementation of Part C of the Federal Individuals with Disabilities Education Act. In New York, it's under Title 2A of Article 25 of Public Health Law, and early intervention was implemented in New York in July of 1993. The Department of Health, as Ryan mentioned, is the lead agency responsible for administration and oversight of EI, and all 57 counties and the City of New York have a designated early intervention official public agency responsible for local administration of the program. We're a family-centered program And the services that early intervention offers include special instruction, speech-language therapy, occupational therapy, physical therapy, psychological services, nursing, audiology, family training, home visits, parent support, nutrition, vision, social work, assistive technology devices and services, and also transportation and respite. And we'll say none of those things would be possible without the collaboration that we have from the counties and the City of New York, which is always a good collaboration and has been extraordinary during this declared state of emergency for COVID-19. Next slide, please. And just a reminder about the steps in the early intervention program, which go all the way from referral through assignment of an initial service coordinator to evaluation, to the IFSP meeting for those children who are found eligible for the program, the list of services, the Individualized Family Service Plan, or IFSP, is reviewed 6 months and evaluated annually. And then finally, the subject of most of our conversation today is transition and the planning for transition, moving on either to preschool special education services under Section 4410 of the Education Law, or perhaps to other early childhood services. So we can go to the next slide, please. So we're going to talk a little bit about the early intervention guidance that was issued during COVID-19, and can go on to the next. Thanks. In March and April of 2020, we issued guidance around telehealth and virtual early intervention visits. And in that guidance, the department said that these visits, telehealth, virtual EI visits, are not normally reimbursable under the early intervention program. However, during the declared state of emergency, reimbursement is available for individual telehealth EI services that are provided in accordance with the child's IFSP. And we had a special authorization form, parent consent form, for this purpose. And as long as the family expressed a need for and agreed to use of virtual EI visits during this emergency, they were offered to the families. This was certainly a new experience for the department itself, for the counties, and for the providers and families who embarked on telehealth services almost overnight. People will recall that we had some discussions in our early intervention coordinating council meetings about which services, how we would include teletherapy in the early intervention program. We had some demonstrations, but I don't think any of us dreamed that back in the spring we would be diving into virtual services literally overnight. Next slide. Thanks. In that guidance issued back in April, there were several, considerations or requirements. One was that prior to initiating telehealth services, a consent for virtual services had to be signed by the family, and they had to understand that these services were in place of, not in addition to their IFSP mandate. Providers and families needed to have necessary platforms to conduct virtual therapy, and as we know, many of the rules were relaxed by the federal government over this time about what could constitute video and audio components for the duration of the visit. Therapy services had to not exceed what was in the child's IFSP. Virtual therapy services had to be at least a minimum of 30 minutes in duration. Providers still need to maintain all documentation of the therapy and note that it was provided virtually, and there was additional documentation guidance issued. And group services could not be conducted virtually, but we did allow for the child's IFSP to be changed to reflect individual services if that was appropriate. Okay, we can go on to the next one. Thanks. So prior to all of early intervention services being delivered virtually, we really did not have standard guidance for this project. And so the initial guidance just allowed teletherapy services to occur, And then the next piece was that consent for use of telehealth during the declared state of emergency. We issued altogether 57 frequently asked questions, mainly related to how we would implement teletherapy, and mainly based on questions that we got from providers over this time. So that was not a small accomplishment, and we thank everyone for the questions that they submitted to us that resulted in all of these FAQs. And they're all posted on the department's website, and I'm going to guess that it's probably one of the places that you consult fairly regularly, or at least did in the beginning of all this. You can go to the next slide. Thank you. So a few more pieces of guidance that were issued more in the June timeframe had to do with additional FAQs and also reopening New York, which in early intervention was really in large part about resuming in-person early intervention services slowly and methodically, because remember, the guidance continues to be to deliver services in EI via teletherapy to the maximum extent possible. And then there was additional guidance about home and community-based services within the COVID-19 declared state of emergency and the precautions that need to be taken if those services will be resumed during this time. Okay, next slide. I think a question in people's minds, and maybe part of the discussion today, will be about teletherapy going forward. At least from the April 1st guidance, it states that when the declared state of emergency is no longer in place, there will be no reimbursement available for virtual EI services until formal guidance on the delivery of EI services through telehealth is issued. So a couple of things in the way of planning for the future. Clearly, the department will, in collaboration with county early intervention partners and New York City early intervention, will study the data and collect information, importantly, I think, from parents and families, and also from providers and other stakeholders about their experiences with telehealth. And if you were at the June 2020 Early Intervention Coordinating Council meeting, the Early Intervention Coordinating Council voted to add teletherapy to an existing task force on early intervention provider workforce capacity. So those things are in our minds. We'll certainly take a closer look at teletherapy as we move forward and consider what we'll do in the way of formal guidance. One thing I will also note is that at last week's discussion, we did ask a question about whether counties would be in favor of retaining teletherapy as an option for early intervention service delivery, and the overwhelming responses in that particular chat box were yeses. So we certainly hear you, and we understand that people are interested in this as a way forward. Okay, next slide. We'll move into transition from the early intervention program, and you can go to the next slide. Thanks. It might be interesting at least to take a look at exit data for the early intervention program, just to wrap some context around today's discussion. New York State serves approximately 70,000 children and families in the early intervention program annually. They don't all come and go in that time frame. So the data that we can see on this slide reflects nearly 30,000 children. So that's the number of children in this particular exit data report. And I think a couple takeaways from this slide. One question you might have is how many children in early intervention of this group of almost 30,000 transferred from Part C of IDEA to Part B of IDEA. And if you add the numbers together for Part B eligible exiting Part C and Part B eligible continuing in Part C for a time, that number is about 17,299. So of our cohort of almost 30,000, more than half exit Part C and move on to Part B. And then a question might also be how many children exited early intervention and did not go on to Part B services in the program year that we're looking at, 2018-19. And that's just over 6,365 children. There are other reasons for exit from early intervention. Sometimes children meet their milestones and are no longer eligible for EI, and that's the top number. They might be withdrawn from EI by their parent or guardian, or they could be lost to follow-up, as we all know. That just gives a little context. So we have practice with moving children from Part C to Part B every year. You can go on to the next slide. Thanks. So under public health law, as we know, there is a provision that allows for children who have been determined to be eligible for Part B services under Section 4410 of Education Law, who turn 3 during certain times of the year, to stay in early intervention a little bit longer, depending on when their birth date falls. So those children of, I think the most interest right now are the ones who turn 3 between January 1st and the end of August. And those children are allowed to remain in early intervention through the end of August. And they would be under ordinary circumstances as long as they had a Part B eligibility determination. This time around, and as people I know from frequently asked question number 57, even if the Part B evaluation hadn't been completed yet, those children were retained in early intervention until the end of August. And we can go on to the next slide. Okay. Lots of planning goes into transition, and I just, since I had a few minutes this morning with you, I want to take a few minutes just to talk a little bit about that. As everyone knows, the Individualized Family Service Plan includes a transition plan, and it includes the notifications, documentation to the family, and there is, of course, a calculator to help us figure out the date so that we can back into the right date for transition for a child in the early intervention program. So I just want to mention those things. The transition process largely falls on the early intervention official designee and the service coordinator, and the responsibility for it. And it needs to be explained to the parent from the very beginning of the early intervention program stay. Next slide talks about transition plan. There's regulatory requirements around these plans. The content for the IFSP is outlined in early intervention program regulations, and then there's a section that outlines requirements for planning itself. For all children in EI, it's important to begin planning for transition as early as possible. And like all things in early intervention, we use a team approach involving the parents, service coordinator, providers, the early intervention official or designee. Everyone works together on these steps toward transition. So next slide, please. So as we all know, a transition plan is required for every child who's exiting, required to be part of their IFSP, and it must include transition steps and services. And next slide. Generally, transition is discussed at the IFSP meeting closest to the child's second birthday, but as a practical matter, it can be discussed as early as 2 years and 3 months of age for the child, and no later than 2 years, 9 months of age. And at least 90 days prior to potential eligibility for preschool, there's a notification that has to be sent, and parents are afforded at least 30 calendar days to object to written notification of the Committee on Preschool Special Education. Okay, we can go on. Thanks. States, as you know, are required under the Federal Individuals with Disabilities Education Act to have policies and procedures to ensure a smooth transition from Part C of IDEA to Part B. The 3 steps that I know we talked about the most during this declared state of emergency were the Committee on Preschool Special Education notification, the transition plan being in place for the child, and the child currently receiving EI services referred with parental consent to the Committee on Preschool Special Education. And, next slide, please. I will point out also that Part C and Part B, that is the Department of Health and the State Education Department, have worked closely together during this time on a couple of things. One is to make sure that our guidance was in sync during the declared state of emergency and all the time. And the other is a Memorandum of Understanding that's required for our programs under our federal overseer, which is the Office of Special Education Programs. So we're a long way toward updating that Memorandum of Understanding, and in it we outline the requirements, which are very similar to the requirements that we just ran through regarding transition from Part C to Part B. Suzanne Bowling from State Ed is going to talk about the toolkit for committees on preschool special education, so I won't take any thunder from Suzanne, but we did talk about it also last week during our meeting with the counties. It's important, and it's important to note that DOH and State Ed work together on it, and we certainly have worked closely with many counties as well during this time, providing technical assistance and hopefully responses that you needed as quickly as we could for all the questions that came up during this very unprecedented time. So we'll move on to Suzanne Bowling from the State Education Department.
So I will present some of the information that we had prepared. Our slides are really focused on just making sure everyone knows where to find the relevant information. The Office of Special Education has a website called the Provision of Services to Students with Disabilities During Statewide School Closures Due to Novel Coronavirus COVID-19 Outbreak in New York State. So there's the link below. So far, in terms of answering questions from the field, we've put out an initial policy document, and then we've done 3 supplements. The supplement documents are responding directly to the questions that we get in our email box. So we have all of the questions that we receive, we collect, we categorize, and then we are assigning staff to put together questions and answers, and those then become what you see publicly posted. Right now, and I'll get to this a little bit later, most of our efforts in that Q&A department is focused on reopening school guidance, because that is kind of the next horizon of what everybody's time and energy and attention is to. But there still is really good information in the initial memo and then the supplements. We also have 2 other supplements that we're seeking that are right now in the stages of review. One of them is more focused on reporting school calendars, enrollment information, and tuition rate setting questions. And then the other is similar in that it has both programmatic and fiscal questions. And those 2 supplements, when they are posted, they will appear at the link below. So we do encourage everybody to, keep checking the link to see if there's additional information. So this is just, again, another reminder of where our preschool supportive health service program guidance is posted on the SED website. And so all of the Medicaid alerts have been posted here. And again, when we get questions from the field, we do work with our partner agency at the Department of Health to put together what we think is responsive to the field questions, and then we will publish them, as well as the Department of Health will publish those questions as well. So just wanted to make sure folks knew where to go to check for that. Can you advance the slide? So as I said before, right now our department is very focused on the reopening plans, and just wanted to kind of make sure that for your preschool special education, the center-based programs are required to submit reopening plans. The itinerant preschool services are not required to submit reopening plans, because the reopening plans and the guidance is very much school specific. And so therefore, although there is going to be, questions about safe provision of itinerant service providers and itinerant services, and that will be something that we'll follow DOH guidelines on. Currently, there is nothing that is posted from DOH that is specific to preschool special education itinerant service providers, but there are things and safety guidance such as home health aides that we could follow, or we have asked the Department of Health if there's going to be more specific guidance that is specific to itinerant services. But at the moment, the guidance that they have issued is very much focused on school-based brick and mortar facilities. And the governor has outlined that both public and private schools must submit reopening plans. And this is applicable not just to school age, but also to preschool. And so what that means for our 4410 providers are that our special class programs and special class integrated setting programs are required to submit reopening plans. They're going to submit information to the Department of Health by this Friday, July 31st. And then they're going to submit information to SCD by August 7th. There is a memo that kind of outlines those requirements, and I put the link there in case anybody is needing more information. So we can go to the next slide. Here is where I posted those guidance documents that are currently available that is applicable to preschool special education. So again, right now, there's just targeted guidance to the special class and special class integrated setting programs. And there are two applicable guidance documents from DOH. One is applicable to childcare settings, and a lot of our 4410 providers are also licensed childcare settings. And the other is applicable to pre-K settings, which also includes our private preschool special education programs. In our conversations with stakeholders, we do recognize that there are two guidance documents, and that can be difficult, especially if there are conflicts. They are substantially similar, but there also are some meaningful differences. Currently, our communication to the field is that the stricter standard will apply to the extent there is a conflict. I'm not sure if, I know there's ongoing conversations with our department and with OCFS. Potentially in the future, some of those conflicts might be addressed or reconciled. But at the moment, we have these two applicable guidance documents from the Department of Health, and to the extent there's a conflict, the stricter standard applies. We can go to the next slide. And Connie had mentioned this, and so thanks for the intro, Connie. We have issued a CPSE considerations for conducting preschool evaluation toolkit. So there's the link on the slide, and I do encourage that folks take a look at this. I know a lot of times where we have talked, there have been concerns, especially kids transitioning from early intervention. And we want to make sure that school districts are doing everything possible to transition in a timely manner children who are leaving EI and who are eligible for preschool special education services. We had heard that there were some concerns about availability of evaluations or the timeliness of evaluations. And so this toolkit is really geared toward those CPSEs so that they can exhaust all options in order to meet those timelines and to ensure a timely transition for students. And so we're hoping that this is a resource in the field that helps them walk through and navigate the current situations of COVID-19 and is responsive to then questions that they might have, or maybe they thought there were challenges and barriers in the past that they weren't really sure how to address, but that now this toolkit gives them some resources for really how to start addressing any backlog that they might have accumulated during those early months of COVID-19 and ensure that there is kind of that we are open for operation, that children are getting evaluated, meetings are being held, and that eligibility determinations are being made. I think that's my last slide, but we should advance and see. I think the next might be for questions. Yes.
Okay, thank you, Suzanne. And our last panelist this morning is going to be Carrie White from Saratoga County. After Carrie concludes her presentation, Again, I just want to remind participants, please submit your question in the questions box on the right-hand side of your screen, and we will go ahead and facilitate a Q&A after Carrie is done. So now I'll turn it over to Carrie White.
All right, thank you, Ryan. Can everybody hear me? I got kicked out and had to come back in.
Yes, we can hear you, Carrie, and I apologize for everyone for those technical issues. We don't know what ended up happening on the back end, but we can hear you loud and clear.
Okay, great, thank you. Go ahead and go to the first slide. Okay, so from the county perspective, Connie and Suzanne certainly covered the timeline and all of the different steps that we've done in each county very well. So I'm just going to get in a little more detail to some of those things. At the county level, of course, the first thing that became apparent with everything during the state of emergency is that the majority of staff got pulled to help with COVID efforts. So trying to keep the program running was certainly difficult. And then, of course, we suspended face-to-face services and had to figure out implementation of telehealth, like Connie mentioned, somewhat overnight. And then, you know, things are starting to open back up in our neck of the woods. So it's reinstating those face-to-face services. Where is that appropriate? How do we do that safely? And then I just have some kind of list at the end that I'll go over. So next slide. So in Saratoga County, we are considered a large county. We did have in March, when the COVID state of emergency was enacted, we had 400 active children in early intervention. But again, overnight, 75% of our staff were pulled immediately to assist at the command center. So that left us with about 3 staff, myself and 2 service coordinators, to handle all 400 of those cases ourselves. What also is important to mention is that most early intervention programs are operated through the public health department, the local public health department. So that is kind of an understanding that in emergency preparedness, EI are typically included as part of those staff, and any of the emergency activities take priority over other public health activities. So that being said, it was interesting because being part of those planning efforts, EI and preschool, really children in general, there was kind of, I guess, an idea that there's not emergencies in those populations. So the first initial reaction was just shut it down. Shut it down, put it on hold, and focus on the emergency at hand. But of course, as Connie and Suzanne mentioned, EI is part of public health law and a mandatory federal program, so you can't just shut it down. So there was kind of misunderstanding and trying to clarify, are we essential, are we not essential? Can we work from home? How do we work in the office and maintain social distancing? There was a lot of back and forth with that for a little while in our county, which complicated things certainly with planning. But go ahead to the next slide. So I just kind of spelled out the different roles that we had, those 2 other staff and myself. So that first initial reaction was, in our county, we're going to suspend services. This was before telehealth had been approved. So our EIO, Kathy Duncan, called Connie as part of our notification requirement with our provider agreement and stated that was our plan, that we were going to suspend services. And we would have to then, of course, notify all of the active families, all of the service providers, and all of our community partners that we were doing that. So we did that through mail, faxes. We used iHands, which is a program through the HCF that can notify medical professionals in the area. And we issued mass notification that way. And then our next step was, so what do we do then with those referrals to early intervention and child find that are still allowed and still mandated? We can't shut down. We still need to accept those referrals. So we had to come up with a plan for that. And of course, how to do all of this from our home. So certainly with everything on hold and things not happening, we had to be sure to document all of that very well because of all those federal targets that we have to meet. And that was certainly a large task to take on. And those service coordinators helped me by calling the families as well as sending those letters just to make sure everybody was notified. We had to change IFSPs. We had to keep track of the children that were in the middle of all those transition processes that you just heard about. And again, all that important documentation. So next slide, please. So then telehealth was approved, which was a great thing because it was very difficult to just kind of say we're shutting it down. We were not comfortable with that. These families needed support. These children needed support. So we were happy that there was an alternative to getting some sort of assistance into these families. So to do that, those guidance documents that Connie mentioned, we had to make sure that all of our service providers and families had been given access to those and understood those. I had to write lengthy emails. Connie, it got to the point that Connie's inbox wouldn't accept my emails because I wrote so many. But really, we wanted to make sure as best we could that everybody understood telehealth and all of the ins and outs to make that happen. There was a lot of work on the county's part with data collection. We created a spreadsheet just to kind of keep track of how many children were participating in that. In our county, 206 families did take part in telehealth based on provider report, you know, and keeping track of all that, making sure everybody had their service authorizations and things to keep services going. The other big thing, of course, was keeping those CPSC procedures in place as best we could, having those meetings so that children were deemed eligible and still had that option to continue services. And then in Saratoga County, early intervention and CPSC are two different departments. So I worked closely with our Youth Bureau department to make sure that what was happening in CPSC coincided with everything we were doing in EI, and we are all on the same page with that. Next page. So we just kind of plugged along with telehealth. Of course, there were lots of questions along the way and additional guidance and support to the providers. That was really the main piece that we did, is trying to make sure that providers were trained in doing telehealth and had the means to do so. I know somebody in the chat mentioned, what about families that didn't have access to technology? We did, actually, that was another big piece of what we did. We, our children and youth with special health care needs program worked with a nonprofit called Computers for Causes, and we were able to obtain 10 iPads that we can give to families that didn't have devices for telehealth. We also worked with our local school district, as they are supposed to provide devices to the school-age children so they could participate in their virtual learning. If any school district had extra devices that weren't being used, they did give them to EI families as part of that requirement as well. So we were able to get devices to any family that needed them. The problem we had then is, unfortunately, some of the rural and mountainous areas of our county don't have the best internet service. So speaking of technical difficulties, we had some of those that unfortunately interfered with telehealth. So now, looking at those situations, looking at the health metrics in our county, we did reinstate the ability to have individual face-to-face services as of July 6th. So again, we had to issue some more detailed guidance about that. We wanted to make sure families and providers understand all the precautions necessary, such as wearing a mask, doing sessions outside whenever possible so there's better air circulation, and distributing that. We actually created a form in our county for parents to sign to show that they did receive that information and that they're going to take those precautions if face-to-face is being implemented in their home. And then same for providers, we advise that they create their own health and safety protocols and possibly even work on that with the families themselves as well. So a lot of data collection, a lot of changing of IFSPs, meetings by phone, all of that to kind of keep things flowing, all at the same time with staff coming and going between our program and helping out with the COVID effort. So it's been very busy, to say the least. Go ahead and go to the next slide. So I think just to kind of sum up a lot of the things that came up in this from the county perspective, and certainly we talked about this at our state meeting with Connie last week, and a lot of these are ongoing things. I mentioned the staffing issue in the beginning, that EI isn't prioritized in emergency planning, so we didn't have the full staff to make things go smoothly at first. I think the other piece was switching electronically very quickly. Our NICE system is not an electronic medical record, so a lot of our forms and procedures and things are not HIPAA and FERPA compliant, so we had to create separate consents for that and kind of monitor all the legalities of those things for when we were doing things electronically. From an office managerial perspective, it was difficult to do just general things. So knowing who my 400 active kids were, there isn't a nice list that I have access to as a manager to tell me all those names and addresses. We had to manually look all of those up one by one to be able to send those letters and call those families. So we're hoping there's a new EI system called the EI Hub coming, and we're hoping that, and it sounds like there will be that capability in the future for us, so it will make situations like this a lot easier to handle. Same thing with the next bullet point. A lot of our data collection was based on hand counting or provider reports. So I don't know that 206 is a definitive accurate count of children getting telehealth. Those are just the families and providers that reported to me that they were doing it during that time. And then some bigger, broader system kind of things that we noticed. We did watch all of the governor daily statements that happened. We tried to keep on top of all of the Department of Health and CDC guidance for health, but we noticed that birth to 5 in general seems to be left out. They didn't really have any direct guidance other than what BEI and NICED were releasing specific to these programs. So, and again, there seemed to be that historical kind of, there's no emergencies in EI kind of idea. So, it just brought up a lot of other questions. Is EI a medical program or is it educational? So maybe that's why it wasn't addressed in some of these avenues, because it kind of rolls into some of these other categories. And then of course, all that work with the service providers brought up everything that kind of happened in 2013 when provider oversight shifted to a New York State agreement, and service providers are not contracted directly with the counties. So of course, in any kind of emergency situation, there's a lot of legality questions, liability questions. You know, does the county back up the providers? Does the state back up the providers? Who approves these safety plans, so on and so forth. So those are some of the questions that came up in all of this. Next slide. So some of those questions did get answered. In the first guidance, EI is defined as an essential service. So that clarified a lot of things that where we fell categorically and how to get a lot of these things into place. And I think that idea that there's no emergencies in EI certainly has changed, that you can't just stop services. It's a violation of IDEA and free and appropriate public education that falls under that for the birth to 3 population. But those were some positives that came out of this, that we had the option of telehealth. And I think, as Connie mentioned, I think all counties or most counties agree that we want to continue to advocate for that as a service model, not just during emergencies, but it has filled a lot of other gaps as well. We've been able to reach children in rural areas that we couldn't reach before. We've been able to provide services that sometimes wouldn't travel to those areas and various other things. And then I mentioned the other 2 points a couple of minutes ago. I think other things that we've learned from this is that you know, from the local perspective, we need a little bit more administrative support with data and ability to collect some of these things. You know, something as simple as a mail merge to be able to send mass notifications, if the system could do that, rather than having us have to create our own separate spreadsheet to do that sort of thing in a large county. That's a lot of work. And then I have always advocated for, and I think this just shows the need more significantly, that we have to include EI and the birth of 5 population in emergency planning, that certainly their families in a pandemic or any community emergency situation, certainly they are going to experience those just as well as any other age group. So that's my perspective.
Great, thank you, Carrie, and thank you, Connie, and thank you, Suzanne, as well. Again, I apologize for the technical difficulties earlier on, but I'm happy we were able to get through everyone's content. We now want to go ahead and open it up to Q&A, and we do have several questions here in the questions box, so I'm just going to start with the first one, which, Carrie, you may have responded to this, but let me ask both Connie and Suzanne in case they want to chime in as well. What options do EI families have for help with technology or internet? It seems like if they don't have a school-aged or preschool-aged child, they do not qualify for the resources from school districts or from internet service providers.
Hi, Ryan, it's Connie. That's a great question, and we did start to think about that during the declared state of emergency. We have, the department has a memorandum of understanding with trade centers, technology-related assistance for individuals with disabilities. We did start to think through, and we'll certainly explore further whether there might be some loan opportunities through that avenue or another avenue, but we definitely recognize that some families didn't have access to equipment that they would need to do virtual services. And one of our pieces of guidance did have some information about contacting local carriers and about internet, accessing the internet. We recognize that's another area that if this is folded into our general, and as an option for service delivery, we'll have to explore these things further, both the equipment and the broadband considerations that go with it.
Great, thanks, Connie. The next question we have is from a county legislator. My constituents have been appreciative of teleservices. However, they have universally told me that they do not view them as nearly as effective. Counties may have a reason to like these services because they can improve their reporting metrics. How does the state agencies intend to balance these competing interests?
It's Connie. I can start. So I think we could debate the relative effectiveness of teletherapy for a long time, longer than we have right now. And I think it's different depending on any number of factors. But there is a body of literature that does show that teletherapy can be effective. But the larger point here is not that debate. It's really the notion that the early intervention program is a family-centered program. And so what we would envision, should teletherapy become part of our service delivery options going forward, our vision would be that teletherapy would be an option for families, that using it would be folded into the individualized family service plan process, and that families would have it as one other possibility, whether it was all-in teletherapy or whether it was some particular service or expertise that they were trying to access that way. But again, it would give us one more option, and families are at the heart of what we do in EI.
Okay, thanks, Connie. Did you have anything else to add, Suzanne, from your perspective?
Sure. I mean, I guess I would say, I agree with everything that Connie said in terms of, the effectiveness of in-person versus remote. And I think we've heard kind of the same, that for some students it has been less effective than in person. But for the school programs in 3 to 21, we really have been just following what the governor and executive order has instructed. And so, in terms of the teletherapy and telehealth, I think we were happy to have an avenue to at least offer some level of service, even if it wasn't what we were normally traditionally accustomed to. I think that's why, the reopening plans, there's so much focus on the reopening plans now, and what the governor will decide and the metrics for when in-person can resume, and if in-person does resume, what the standards are. I think we kind of saw over the summer, the governor gave us flexibility to start offering in-person services, but then guidelines by which would have to be met in order for that to occur. And similar with the reopening plans, again, here everybody, if you're going to be doing in person, here are those guidelines that you have to meet in order to safely do so. So I think we're optimistic that, the conversation is now shifting into reopening. But I think, again, we've always said that the provision of services has to also consider the health and safety of the students and the professionals who are delivering the service. And so if you can't deliver the service safely, then teletherapy and telepractice right now is kind of our alternative resource.
Great, thank you both. The next question, and we'll do a couple questions here and then we'll wrap it up to just be respectful of everyone's time. If a 4410 program has opened, my understanding is that they needed to submit a plan to state ed department. Can counties get access to those plans?
So, and I will answer this, and then I have to unfortunately jump on to another call. The plans are supposed to be publicly posted. And I want to caveat for one thing. For summer, the governor did not require a reopening plan. The governor's guidance said that the school district would request and the provider could say yes, and then the guidelines were the guidelines and the provider must adhere to the guidelines. For 10-month for the school year programs, that is when the reopening plan period is beginning. And so those reopening plans are for fall programming. They are required to be, they're submitting to the Department of Health this Friday. They're submitting to SED on August 7th. And both DOH and SED have the expectation that those plans be publicly available. The first preference is that the provider, if they have a website, that they're linking their plans on the website. So if there is a website associated with a provider, then it should be on their website. If there's not a public website for that provider, then we have told the providers that they can use like a social media group. So they could do a Facebook group, for example. They could do an email listserv. They could kind of have like a box sharing net service where then it's provided to stakeholders, and counties are of course stakeholders. So you can ask the provider, I would like, a copy of the plan.
Okay, great. Thank you, Suzanne, and thank you, Connie. This will conclude today's webinar. If anyone does have additional questions, please feel free to email them to NISAC, and we'll get those over to Connie and Suzanne to try and get you an answer. But again, I just want to thank all of our panelists today, Connie, Suzanne, and Carrie. The information you've presented is incredibly timely, and the folks here at NISAC and the counties on the line, we're just so appreciative of you taking the time to join us this morning. So thank you, everyone.
Thank
Thank
you.
you,
Have a good
Ryan.
day, everyone.